Hello people of the world. As studies continue for Klinefelters syndrome and XXY studies, is there a need for early identification and treatment for XXYs who've got Klinefelter syndrome? Klinefelter syndrome is not usually diagnosed before the preteen years because there are no symptoms or because symptoms go unnoticed until puberty. However, a doctor may suspect Klinefelter syndrome when a young boy has difficulty learning to talk, read or write. During puberty, some males may be suspected of having Klinefelter syndrome, including those who are taller than other males in their family and have long legs, have small testicles that do not increase in size as puberty progresses, have enlarged breast tissue that persists for more than 2 years, having learning or social problems such as lacking self-confidence and being shy, immature or dependent, or have mild mental retardation, because Klinefelter syndrome is present in about 1% of males with mental retardation. Tests for Klinefelter syndrome during childhood or puberty usually include a medical history, physical exam and karyotype. If we take into consideration that a lot of XXYs are actually not diagnosed until they are adults, it's normally because they go to get tests to check about their infertility. So sometimes it's not diagnosed until adulthood, when a man seeks medical care to determine the cause of his infertility. About 3% of infertile men have Klinefelter syndrome. Tests include a medical history, physical exam and karyotype. A man may also have hormone tests and a semen analysis. It's not at this stage quite sure when is the best time really to tell an individual XXY Klinefelter syndrome person what they have and at what age, because it's up to the individual and the family circumstances of how the child is going to understand that they are XXY or that they might be XYY. Different chromosomes and different head, and also certain physical differences to the normal males and the normal females in the world. But certainly early diagnosis, at least for the parents to know, I think is a necessary thing to happen, to be realised, that it's much more important that the parents know throughout their life that a person is XXY, because not every XXY is the same, but there are a lot of issues that are not looked at, because normally the XXY boy is treated as a boy who's supposed to be growing into a man and actually isn't totally developing as all the other boys are in general. Not everybody. Get a diagnosis early in life. Most males are not diagnosed until the start of puberty or later. An early diagnosis allows a young person to obtain support and treatments that can prevent problems with peers and self-esteem. A physical exam and chromosome test can confirm a diagnosis. Educate yourself on the symptoms and problems associated with Klinefelter syndrome. If you have a child diagnosed with this condition, ask your doctor about support services available. Contact the Klinefelter syndrome associations in both America and the UK and anywhere else you know of. They have information on treatment and suggestions on dealing with emotional or behavioural problems. Encourage participation in activities such as sports. A teenager needs to feel like he fits in with all the other kids. Take testosterone or estrogen. It can be given via an injection, a gel or a skin patch. It can help by increasing muscle mass, increasing sex drive, increasing the growth or non-growth of hair, and these changes may help the individual feel better about themselves. Consider surgery. A small percentage of people with Klinefelter syndrome will have breast growth. Surgery can be performed to remove breast tissue in the form of a mastectomy. Your doctor can evaluate your need for surgery and provide more information on this option. Talk to a counsellor as well regarding feelings you may have, because males of different ages may be dealing with different issues. For example, an adolescent male may need to find ways to cope with teasing from other kids. An adult male may have concerns about infertility. A counsellor can refer you to a support group that may help. It's extremely important for your mind to be as good as your body throughout your life, because XXY chromosomes doesn't go away even with the addition of hormones in your life. You will always be an XXY chromosomed person or an XYY chromosomed person. And there are other types of chromosomal differences in human beings. We are not the only different type of species. There are also technical females, if you want to call them that, who have just got one X chromosome. They don't have an extra X chromosome. They just have one X, and they are called Turner syndrome. So many Klinefelter syndrome people who are newly discovering what they are and what they have don't realize that there's also are kind of direct opposites, if I could say that. So it's interesting as you discover about yourself that you've always been, whether you got diagnosed later in life or whether you were diagnosed younger in life and your parents told you or your doctor told you at a certain age. We are all one, but we're not the same, and once you discover yourself and all the intricacies to yourself, your personal being, because of your genetics as well, but not just solely because of your genetics, it's really interesting just to breathe and be like, wow, I'm me, I'm doing myself a favor to look after myself as I want to be. And my best advice to you is, when you get diagnosed as being XXY or XYY or Klinefelter syndrome or whatever they diagnose you with, Turner syndrome, or as a transgender person, just realize that it's not actually as bad as it seems. And certainly my YouTube experience would show that I am one of the people in life that definitely has their issues, extreme issues. But if I can deal with it, then you can deal with it. So I wish you all the best of success with dealing with yourself and maybe your newfound information. Or maybe you've known for a long time that you're XXY or XYY or XO. It's alright. And the more and more XYs and XXs out there, these typical normal males and females, the more that they find out about us, the better for all of us, don't you think? So let's make sure that next year, for the Klinefelter Syndrome Awareness Week, starting March 15th to the 22nd, 2010, let's make sure that we make our footprint a much bigger and beautiful imprint on the moon, no, on Earth, and make a huge impact, like a meteor of information, into this world, so that people don't have to suffer by not realizing what they are, who they are from the start. And everybody's entitled to know, the issues with their health, and their genetic code, for instance, is important to know from an early age. And so my heart goes out to anybody who got diagnosed in their mid-20s or later in life, when they wanted to have a family. And I know some of you are crying on this because it is a horribly emotional issue when you find out that you can't have children naturally. But we're living in an age where it's actually possible to get artificially your partner pregnant, basically. Don't listen to that if you're homosexual and your partner's a man, even though, but that was a transsexual man that had the baby. But anyway, my point is that there are possibilities for being a parent to a child. Let's put it that way. And I've had to deal with it myself. The infertility issue for me has I think shaped my life. Yeah, and I knew that from an early age. From 21, I knew that. So it is tough. I'm 33 now, 34 nearly. So I've been dealing with thoughts of this for more than 13 years. And so it does take some time to digest, completely understand that. So I hope this video was of use to anybody out there, because there is much more need, isn't there, to be hearing rather than reading people's thoughts on these issues. Okay, peace out, enjoy your day, ciao.